Hello, my name is Christian. I'll be your nurse today. Today we're going to be doing a wound dressing change. I'm going to be changing your old dressing and changing it with a new one. Okay, before I get started, I'm going to perform hand hygiene. Just for demonstration, I'm using hand sanitizer. Alright, so I'm going to be lifting up the bed for you, okay? And then I'm going to need you to turn over in a supine position where your chest is laying on the bed. Okay, great. At this point, I'll make sure I help the patient turn over and expose the buttocks of the area where the area I need to change. So again, I already performed hand hygiene. So I'm gonna be putting on non-sterile gloves. Okay, great. I'm gonna be setting up with a waist bag, flipping it inside out. And before this, I would already have the two patient identifiers explained to the patient. All right. Once I'm on this point, I'll be changing the old bandage, so I'll be removing it. So I'll take off the sterile pad. Looking at it, noticing the coloration, I'll be looking for the odor, which there's slight odor to it. I'll be removing the gauze pad, putting it in the waist bag, and then I'll be looking around for any dead tissues. And right off the back, I can already tell it's a stage 4 because of the muscle loss and the exposed bone prominence. And I'm observing and I see that there's channeling and undermining on the patient's wound. Okay, the color is red with the wound drainage being moderate. Okay, and at this point forward, I would have my measuring device with the cotton swabs. So I'll be opening the cotton tips. Okay. From here, I'm gonna be measuring the length, the width, the depth, and how far is the undermining and the channeling. So first, let me get started. Okay. So the length is roughly 10 centimeters. Okay. Just put that back inside. Okay, and then the width is 7.5 centimeters. And then I'll take out the cotton tip, measuring the depth. So I'm gonna be going the furthest I can go on the wound, going slightly eye level. Okay. The depth is 3.5 centimeters. And then I'm gonna be measuring the channeling. Channeling is 3.5 centimeters. And I notice that there's undermining going in the furthest point. Okay. And it's at 2.5 centimeters. I'm gonna be throwing away the cotton tip in the waist bag. Okay. And then I would discard that as well. Okay. So at this point forward, I'm gonna be removing my gloves. Making sure that I don't touch the outside portion. Okay. And from this point on, I'm going to be performing hand hygiene, the CDC guidelines. Great. Now I'm going to be setting up my sterile field. Okay. So I'm going to be grabbing from the corner, no greater than 1 inch. I'll open it. Okay. And then I would make sure I'd grab the border 1 inch. making sure to keep everything inside, not putting any contact, I would grab the corner that was already exposed, that's not any greater than 1 inch. Okay. Okay, and then I'll discard this. And then from here, I'll be donning my sterile gloves. Okay. Again, same thing, the 1 inch border. Okay, great. And then I'll be ensuring that I'm touching the inside of the cuff, starting with my dominant hand. Okay. All right. And then with my sterile right glove, I'll be picking up on the sterile portion and going underneath the cuff on the sterile portion again, just like this. Okay. Okay. Now I put on my sterile gloves. I'm gonna be cleaning the wound sites. I'm gonna be starting at the bottom of the wound, in the middle of the wound, to the top of the wound. So with the first swab, I'm gonna be cleaning the bottom portion, making sure I get the channeling and all the other portions on the bottom of the wound, discard. Okay, and then I'm cleaning the middle portion. Throw that one away. And then I'll be cleaning the top portion, making sure I get the undermining as well. Great. Since I'm done with that, I'm gonna discard the packaging. All right. Now I'm gonna be applying the gauze using sterile technique. Okay. I'm gonna be adjusting the gauze slightly. Okay. There we go. Great. Now I'll be discarding these. All right. Now I'm gonna be grabbing the sterile pad, putting it over the patient's wound site. Okay. Now we'll be using the tape to tape the sterile pad. Ensuring that I don't keep contact with the patient's skin and tearing it. I'm ripping it by eye measuring it at the very top. Okay, we're almost done here, so I just gotta finish up the last bit of the tape. Okay, so I'll discard the tape as well. All right, now we're all done. I'm gonna be disposing all my sterile equipment or any equipment that I use. Great. I've grabbed the bag. All packaging in there as well. And then, just for the video purpose, allowing you to see the bin, I'll make sure I'll properly dispose of it. Okay. And then I'll be removing my gloves. Grabbing the under portion. Great. Now I properly dispose of the glove using hand hygiene. Okay, from this point on, I'm gonna reposition, help the patient go back in a neutral position. I'm gonna lower the bed. All right. Is there anything else I can do for you today? Okay. Is there any type of maybe food or drink you would like? All right, great. All right. And you didn't have any severe pain while I was changing the wound dressing? Okay, it was a slight pain. Okay, got it. All right. Well, here's the collar. If you need anything, it's gonna be on the both sides of the bed. I'll be back shortly to reassess you. Okay. And then I'll leave the room again, performing hand hygiene and give the patient privacy.